Daddy Squared. Gay Dad Saved the World.
A daily dose of gay dads on the front lines of the global pandemic.
With Alex McGann and Jan Dick.
Hello and welcome to another episode of Daddy Squared, Gay Dads Save the World. Alex.
Yes.
Madonna was tested positive for coronavirus. She actually had the virus.
Yes.
She now has the antibody.
Yeah, I mean, it doesn't matter with Madonna. And the reason Madonna is unkillable. I mean, Madonna could eat like Ebola sandwich and she would be fine. Madonna can't be killed. Madonna and Cher.
The virus is coming and she's like, no, I'm not having
That's
that
right.
today.
No, it's true. She's fine. I'm glad to hear it, but it doesn't matter.
Yeah. Well, and another entertainment news. I'm like, we're Us Weekly today.
You're Us Weekly.
Us Weekly, Alex.
Yes.
We're all weekly.
Yeah.
So Anderson Cooper has a kid now.
Mazel tov.
So he has a baby named Wyatt. And everybody's
super
excited, and suddenly it's cool to be gay dad.
He's going to have a Cooper Cooper. Look, here's the thing. I don't care. And while I think Anderson Cooper's a great guy, I don't know him personally. He and I don't hang out, you know. The thing that upsets me is when people take away my gayness. Like, damn it, I'm gay.
Dadness.
My gay dadness, right?
Yeah, it happens with Andy Cohen too.
Yeah, well,
you know,
it's like,
suddenly people are so interested and are so like, it's like on the cover of People magazine because Andy Cohen.
Well, to be fair, I mean, if Anderson Cooper was straight and he had a baby, they'd want to put a picture of that on the front cover, what other trash it is that you're talking about. But I feel like if I'm saying this, some of the people who we've interviewed over the last several days who have 20-year-old, you know, children and, you know, they're gay men are probably like, wait. You know, we were long before Alex and Jan even, so maybe they should shut up too. Yeah. So it's a problem.
Well, but we don't speak in the name of all gay dads.
Oh, I do.
And I feel that the media is now looking for these people who are like fathers for like 2 days to speak in the name of gay dads, and I don't think it's fair.
Well, I'll tell you what I am looking forward to during this.
To interview Anderson Cooper here on Gay Dads Podcast?
Sure. We'd love to have him on. That would be fun. I actually think he's a fun guy. I think he has...
Andy too.
I don't know Andy.
And Andy is Jewish, Alex.
No shit, look at his name.
Do you want me to set you up with him?
I'm taken already. Thank you. The love of my life sits by my side. Anyway, the point is that we're very happy for him. We think that it will be very exciting to see during this pandemic when the amount of nanny support he can get will be relatively limited, to see how he starts looking worse and worse and worse on the news.
Forget it.
It's going to be great. I can't wait. Maybe he'll get fat, which would be awesome too.
We are a couple of bitches, aren't we?
We're bitchy, Anderson.
Well,
we
Anderson
think you're great.
Cooper and Andy Cohen, if you're listening to this, truly sorry, we think you're great.
Yeah.
It's just the media that annoys us, I think.
Well, he is the media. Both of them are the media. And by the way, Andy...
No, they're actually the gossip, the media, the entertainment media. Anyway, today we're calling Texas, McAllen, Texas. We're going to speak with Emmanuel Pantoja, or Pantoja.
I've decided it's Pantoja, but he can really correct us.
All right. He's a family nurse practitioner, and let's make the call.
Let's do it. Hello.
Hello.
Hi.
Emmanuel.
Hey, how are you guys? Yes?
We're good.
Hi. Tell us a little bit about your work.
I don't know.
So there has been, I'm a family nurse practitioner. I'm a registered nurse, advanced practice. It's changed quite a bit, very significantly. I work in a rural family practice, and we typically see about maybe 30 patients a day, you know, one-on-one physically. Mm-hmm. So that has completely changed. Now we're actually transitioned over to primarily what we call telemedicine. So video conferencing, telephone calls is how we reach our demographic right now. We are seeing a few patients in clinic, but that has kind of impacted, you know, our work, and, you know, the practice owner has had to cut back some hours. So yeah, we've been significantly impacted by COVID right now.
So I'm curious, if you do see patients in the office, why do those come in? Like what tips the scales for we need you to come into the office?
So we treat a lot of chronically ill individuals, and we also provide a little bit of pain management. So a lot of the controlled medications, these are the patients that really have to come in for a triplicate. I'm sorry.
Yeah.
And we're also screening them before they come in. We have a series of questions. There's a protocol that we follow. Basically, we check a temperature, we ask about travel, and it's very, very, very few patients that really come in. We probably see maybe about 3 patients per provider, and the rest of them are mostly the teleconferencing.
Is this really good in terms of when the virus craziness has passed? Are you guys going to want to try to do more of this?
So we've talked about it, and it's really opened up a huge door, an opportunity for us as healthcare providers, and being able to reach those individuals that really can't get out of their house.
Right.
Like I mentioned, we're in a very rural area, deep in South Texas, almost very close to the border. So we service a lot of elderly that really don't have transportation. So if we can reach these people via telephone call, mostly everybody has a phone, and through this technology, we're able to provide a better service and treat them from home. We can be calling them and treating them from home, but because of payment plans with healthcare insurances, Medicare, Medicaid, having to see a patient come in clinic is really the bread and butter, and being able to bill for that service is something that I don't think the doctor's willing to give up. 100%.
Sure, unless of course that
really opened the door, like I said, of opportunity for us to be able to see more patients, or at least the ones that can't leave home.
Does the very fact that people are stuck at home result in a different set of ailments because they are stuck at home? Are you hearing complaints about, I don't know, I sat and watched Netflix for 12 hours and as a result my knees hurt? I don't know. I have a thrombosis, whatever.
That's kind of scary, but actually being home and not being able to really leave their home has really increased anxiety and depression in a lot of the individuals that we see in clinic. People that didn't really suffer from this are now calling, telling us they can't sleep, that they're very nervous, maybe even we're in full, allergy season down here, or the whole country actually. And, people, even a little cough, it's really heightened their senses and really focus their attention on their health more than anything. And it's funny you say the whole thrombosis thing. I had a lady call me yesterday. She said that her legs were a lot more swollen than they usually are. And, asking her a series of questions, trying to really get down to the problem. It's just that she's been sitting
watching Netflix.
Watching Netflix more than she typically does.
Yeah.
So
now you can ask about it.
Well, no. I just wanted to say that thrombosis is the only medical term that I know, so I use it all the time. And I love the word. I wish that there was like a good band named Thrombosis.
Thrombosis, yeah.
But anyway, enough of that. So can you tell us a little bit about your family situation?
So Carlos and I have been together for 10 years, going on 10 years already, and we've been married for 4. Having kids or raising kids was always something we both wanted to do. So about 3 years ago, we started the process, thanks to a group of our friends that kind of introduced us to foster to adopt option. Uh-huh. So we decided to go that route, and we fell in love with these 2 little boys from out of town, and they eventually ended up with us. And shortly thereafter, we were asked to foster their sibling, their little sister. We got her when she was about 2 months old, and now she's just turned 2 in February. So
you have you have 3 kids.
5 now.
You have 3 kids, and what are their ages?
Robert is 9, Josh was 7, and Sophia is 2 years old. She just turned 2.
How is it like living deep in the south of Texas, as gay dads?
As a gay family, it's very interesting. I mean, we live in a very primarily Hispanic area. Our families mostly are from Mexico. Down here, 99% of the population, 90 to 99% of the population is Hispanic. So the idea.
So it's a Trump area, then you're saying.
I'm sorry.
I'm sorry. I said it's a big Trump area.
Very much so. Very much so. So, it has been, I guess, a shocker for individuals. We go out together before this, our dinners, our outings, to the store, people stare and look at us. And,
Right.
our kids are half Hispanic and half white. So, they look at me and my husband and we're completely brown, and then 2-3 little white children with us. So it is a big shocker for them. And the question always comes in now, is your mom white? Is your mom white?
Right.
Everybody will ask us. So it's funny. It's interesting, but we don't mind sharing that with people. And, Carlos and I are very social. So we do have a couple of friends who have kids as well. And it's just something that people are not used to, but they're seeing more of. So,
Right.
So there's a little change down here coming around.
Well, I have to think that, in a lot of ways, you're a much more significant ambassador than we are. We live amongst a million other gay dads. It's almost boring. And, can you tell us a little bit about what the kids are doing and what you're doing with them to keep them from going nuts during this time?
Oh my God. So, I mean, it's been a huge adjustment for everybody, including them. And we kind of are fortunate that Carlos is a full-time student. My husband, he's a full-time student. He's also a small business owner. So he's had to close his business down. So he's just at home, and he's still going to school full-time, but he's able to stay home. So he's been the one managing the kiddos and helping them with schoolwork, because all of their schoolwork is now here at home, and we're able to do some interactive activities with the school, but they're usually done by 12 for midday. And then from there on, it's trying to figure out different things for them to do. And sometimes, and they they have a profound new love for their bikes, which they had for a long time. They just rediscovered that they had them in the garage. So
right.
We're trying to find innovative ways. And Carlos is very creative. They'll sit down and the one that we have the hardest time with probably keeping busy is Sophia. I mean, she's a 2-year-old toddler running around and just sponge, just filling her brain. She needs more activities.
Yeah. Listen, our kids we have twin 4-year-olds. I remember when they were 2, this would have been really hard when they were 2.
Oh my God.
Do you feel like that there are some, other than the bikes, which is actually a good one, are there any silver linings to this experience overall that you want to share with us?
So we made it a point now because we're always, before COVID, I mean, we had so many activities. The kids were going to church after school. They had karate. So we never really, to be honest with you, other than the weekends, sat down to have dinner and talk about our day. So I think we've connected at a different level now. And the kids are finding out more things about us, and we're finding out more things about them now. And we've only had the children for 3 years, going on 3 years now. So I mean, it's we're learning more about each other and spending more time. And I think the kids are liking that a lot now. So that's a silver lining for us.
Yes.
I think that makes a lot of sense.
Mm-hmm.
Yeah.
All right. So look, this is the spin question that we throw in at the end. I hope you're ready for it. You ready?
Okay.
Yeah. Over the last week, what is the meal, your own meal or a meal with your family, that you are the most ashamed of?
Well, Robert just turned 9 on Sunday. And we typically have family over, and we finish the cake. And for the last week, I've been having cake after dinner every night after the kids go to bed. So that's probably the most shameful meal I've had.
I mean, it's shameful. I was hoping for something much more disgusting than that, but we'll take it.
One day we're going to hear your thing, Alex.
Oh, yeah. Well, I don't know if you guys can handle the things that happen late at night in this house. Listen, we cannot thank you enough for taking the time to talk to us, and of course for everything that you're doing during this incredibly difficult world pandemic.
Yeah. Well, no, thank you for giving me the time to share our experience from Texas down here in the Rio Grande Valley.
All right,
Thank you, Emmanuel.
Thanks so much, Emmanuel. Take care of yourself.
Y'all have a great day. Take care. Bye-bye.
That is clear.